Welcome back. Thanks for staying with us. After receiving word that Moshi drivers were up in arms about road conditions, Grosley MP Leonard Montoute took the drivers to task for exaggerating the situation. He says the condition of the roads do not warrant the level of complaints that he was informed about.
The action is a little premature and unjustified in the sense that the road is not in such a deplorable condition as they're making it sound, because up to recently and on a regular basis I have the Ministry of Infrastructure doing continuous potholing and maintenance of those roads. It is rough, yes, and it has come to the stage where it needs total resurfacing, but we are coming to that. But in the meantime, it is not one of the, I have many bad roads in my constituency. It's not one of the most deplorable roads at the moment. So I think the Moshi bus drivers could be reasonable, bear some patience, and await the overall resurfacing. And in the meantime, they do not have any justification, and you can go there yourself and film the road that it is not in the kind of condition that they are claiming it.
Nonetheless, the MP says the road is earmarked for repairs in the not-too-distant future.
Fairly stated in the last budget debate that it is down for some attention this year, and as soon as the road rehabilitation and maintenance program is launched, that is one of the roads that I have as one of my priorities. And so I've said so, and I'm repeating that again, that this is one of the roads that is going to be done.
That was Grosley MP Leonard Montoute. In other news, primary care public health professionals are expected to become equipped with leadership skills to enable them to perform effectively in the delivery of health services around the island. More from Frenel Neptune.
The London School of Hygiene and Tropical Medicine, in collaboration with Health Education England, recently facilitated a leadership training aimed at increasing the confidence of primary care leaders in the delivery of patient care services in St. Lucia. Associate Dean of Health Education England, Claire Inkster, says this training is important as it will empower the primary care leaders to make changes and enable service transformation.
We measure healthcare quality in a variety of ways. So we want the healthcare to be safe and people not to be harmed by accidents or errors. We want the treatments that people are accessing to work. We want it to be effective. But in some ways, just as important, we want people to have a good experience of their healthcare. And that's something that we're already hearing from the team this morning, that it's important that people don't have an unpleasant time when they're at a very difficult time in their lives. And there are other things like making sure that people have access to the healthcare that they need. So we will be asking the teams to implement improvement projects which will hopefully have these types of benefits for the patients in their areas.
Medical Officer of Health, Dr. Sharon Belma George, says this training is timely and crucial to improving the delivery of excellent health care.
We note the importance of effective leadership, and especially in health, in terms of strengthening leadership within the Ministry of Health and leadership with a lot of our programs. Public health and primary care is one of the very important areas within health in terms of strengthening preventative care and also surveillance of diseases, and a lot of our heads are the ones who manage our programs. So this leadership training is very timely, as we do have some new members of our team who may not have had it, and some persons who definitely need a refreshment training.
The leadership training focused on key areas such as foundation of leadership, quality improvement in leadership, and action planning for service delivery, to name a few. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fernel Neptune.
The Ministry of Equity, Social Justice, Local Government and Empowerment, along with the Department of Economic Development, Transportation and Civil Aviation, signed a Memorandum of Understanding with the United Nations Children's Fund, UNICEF, on Wednesday to formalize plans to conduct St. Lucia's second Multiple Indicator Cluster Survey during 2019. Rochelle Gonzalez tells us more.
The signing of the Memorandum of Understanding for the implementation of a second Multiple Indicator Cluster Survey, MIX, has been made official. The initiative signifies a union between the Government of St. Lucia and the United Nations Children's Fund, UNICEF, Acting Permanent Secretary in the Ministry of Equity, Social Justice, Local Government and Empowerment, Velda Joseph, said the initiative is a household survey which seeks to collect data on various indicators and parameters particularly pertinent to women and children.
That is very important for us because we recognize that as you make decisions, as you plan programs, as you implement programs, you need to make sure that your programs are purposeful, that they're targeted, that they're addressing deficiencies, and that they are really the programs that are required to make that change that you desire. And so we recognize that having data for that kind of evidence-based decision making is very important. And we embraced UNICEF when they approached us with implementing a second round of mix. And I'm saying a second round because we did a first round of mix in 2012. That was successful. The report is around. The report is also available electronically on the website and on the World Wide Web. And so persons can see what emanated out of that as a result. We're very happy, as I indicated, that we will be rolling out round 6 because we want to see what has changed. We want to see what the gaps are now, what are the deficiencies now that we should be addressing.
Monitoring and evaluation specialist with UNICEF, Alexandra Natia, said from the information gathered so far, there are areas which are thriving and others in dire need of improvement.
We have very good progress in certain areas. For example, we know that the health outcomes in general of the children and women are good. For example, the child mortality has decreased in the country a lot. More women are delivering births in institutions. They go to antenatal care. There is also the nutritional outcomes are good of children. But we know that there are certain areas which need attention as well, especially when it comes to overweight of children, understanding the violent disciplining practices for children and how their parents engage with the children. We want to know more in terms of the quality of the water at the household level, something that we are looking for the first time. In terms of the data from the country.
Claudius Emmanuel, who is the Acting Permanent Secretary in the Department of Economic Development, said it is a collaborative effort on the part of St. Lucians to improve the quality of data gathering for the aspect of the socio-economic life of the country.
It's experiencing some improvement, although the UN representative indicated that in terms of the level of coverage for St. Lucia and the Latin American countries, it's about 60%. So we are still some ways off the target, which clearly would be towards 100%. So there's some work to be done, and we are committed to increasing the capacity of the local team at the statistical office. And in fact, as part of this program, you would expect that would be a key component in that it will allow the statisticians, the staff of the unit, to be able to increase their capacity and to do an even better job going forward.
The signing ceremony was hosted at the Bellevue Hotel in La Panse, Castries. Reporting for Hot 7 News, I'm Rochelle Gonzalez.
The St. Lucia Diabetic Retinopathy Program has received positive and resounding feedback for its progress since its implementation in 2017. Fennel Neptune tells us more.
Officials from the London School of Hygiene and Tropical Medicine, which manages the Queen Elizabeth Trust Diabetic Retinopathy Program, recently paid a visit to St. Lucia to meet with the steering committee to make an assessment of the program since its implementation. Technical consultant of the Caribbean Diabetic Retinopathy Program, Dr. Kova Baskarang, says she's very pleased that the Diabetic Retinopathy Program in St. Lucia has evolved rapidly. She says the dialogue provided them with the opportunity to discuss the next steps for delivering integrated eye care services on island.
As well as meeting the steering committee for the diabetic retinopathy program, we also met with the permanent secretary and the chief medical officer to discuss two aspects. One is that in terms of the program, the Vision 2020 link input continues, and we have plans for further training and capacity building. as well as for introducing quality assurance, where we make sure that all the screening that is being done of the diabetic retinas stays at the right quality levels. In terms of the discussions with the Permanent Secretary, we were talking about the need for reviewing the broader eye care strategy for St. Lucia at Ministry of Health level.
Medical Officer of Health, Dr. Sharon Belma George, says she's very delighted that the meeting granted them the opportunity to chart the way forward for eye care services in St. Lucia.
We were very pleased in terms of where we are at this moment, because we've been able to successfully implement the program in a sustainable way and also providing a new service to the public. But in terms of our planning for the way forward, we were quite pleased to know that with the funding moving forward, we will be able to expand the program to include a more holistic eye care program. So we'll be doing an assessment of our eye health programs, looking at our different gaps for expanding the program. So we are quite excited about that, and we will be looking forward to working with them in the coming years.
Currently, St. Lucia has 4 diabetic retinopathy screening sites and 1 laser treatment site. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fenel Neptune.
Tennis in Glasgow is up next with all the sporting action.